Hey guys, welcome and welcome back to this YouTube channel. In case you're watching this video for the first time or you have clicked into this channel for the first time, kindly consider clicking that subscription button and don't forget to leave a comment, share, and don't also forget to turn your notification bell so that every time I post a video, you will be the first person to be notified. So guys, today I want to talk about pregnancy sleeping position. What are the best position a pregnant woman should sleep using? So when you are pregnant, take this key point at home. So I was saying these are the key points that you should take at home when you are pregnant. So expert recommend sleeping on the right position, on the left side position, not on the right position. This is because it increases the blood flow to the fetus and the uterus. Another point that you should know is that finding the ideal sleeping position is essential for both the mother and the baby because of comfort. For you to get comfortable and for your own safety and for the safety of the baby, you should find the right position. Yeah, you should find the right position. Another thing that you should know is that back sleeping when you are uh, pregnant, sleeping on your back when you're pregnant can increase back pain. This is mostly happen when your abdomen has already grown big, and sometimes it also usually happen when the pregnancy is starting. So the expert discourage sleeping on your back. Another thing that you have to know before we talk about this sleeping position, whatever, using pillow for to support can adjust your sleeping position during pregnancy easy, and it can help you get a better sleep. So if you're pregnant, you can use pillow to put in between your legs, and also to do what, to put on the left side when you're sleeping, to put you in your head on the left side when you're sleeping, so that at the same time you get comfort and safety, plus the uterus and the fetus get enough blood supply. Another thing that let us talk about is when you are pregnant, you get that you sleep a lot. You sleep a lot because your body is relaxed at that point, and also you are also carrying a whole human being. Your body is carrying a whole human being. You're a machine. So some women tend to get a lot of sleep, and I don't think even it is just not for some women. Most women usually tend to get a lot of sleep. So most people require extra sleep to meet the physical demand of pregnancy. However, as pregnancy progresses, sleep can be harder to come by. When mostly, let me say, I'm saying, uh, as the pregnancy progresses, as the pregnancy grows, or as the baby grows in the abdomen, sleep can be harder, and this can be caused by more than 2/3 of pregnant people experience a sleep problem over the course of their pregnancy without a good sleep. So it can be difficult to remain alert and productive throughout the day. So many factors can disrupt sleep, during pregnancy, and this could include nighttime bathroom trips. You know, when you're pregnant, you tend to go to the toilet frequent. Sometimes nausea and vomiting. Nausea and vomiting comes with the what we call morning sickness. And morning sickness, I don't know the reason why they call it morning sickness, because sometimes you can go through it the whole day, the whole night. In fact, you can be bedridden. So I don't know the reason why these people call this thing morning sickness, and it is not even usually coming in the morning alone. It can be the whole day, the whole night. In fact, I'm saying you can be bedridden. So that one is also something that can cause, can make you trouble when you're pregnant, can make your sleeping trouble when you're pregnant. Heartburn is also another problem. Yeah, heartburn is also another problem, but it is manageable. Low back pain and leg cramp for some people. Some people, they don't experience it. Yeah. So we can say that as their bodies grow and changes occur, the fetus the body accommodate the fetus, and many as the time goes, you find some of the ways you can sleep well. Sometimes you can sleep too much in the what during the day, and at night you have trouble with sleep. So the most important thing is here, you sleep and you relax, so that you don't get a lot of problem when you are pregnant. Now, let's talk about best sleeping position during pregnancy. So most expert agrees that once the abdomen starts to expand, it is best to sleep on the left side with a knee bend. Not only is side sleeping more comfortable, it's also improve blood flow to the uterus. Remember, we had already said that, and also to the fetus. So stomach sleeping is also considered safe during early pregnancy. So if you are in your first trimester, you can sleep on your stomach, but it eventually become impossible usually as the time goes. When you get into your second trimester, sometimes you can't sleep on your stomach or on the abdomen, because this position will compress the baby in the what, in the uterus. Okay, let's talk about that left and right side sleep. So sleeping on the left side during pregnancy facilitates blood flow, and it ensures the vital organ in your body and the body of the baby receive enough nutrients, receive enough oxygen, and receive enough blood they need. So this position also decreases the likelihood of swelling in the knuckle and the legs. And sleeping on the right side can put pressure on the liver. So if you are pregnant and you're sleeping on the right side, you are putting pressure on the liver, so it is not optimal. It is not functioning the way it is supposed to function. But experts generally agree that it is safe to sleep on the right side for a short interval, because sometimes you can't sleep the whole night, the whole day on your left side. But they prefer that most of your time, or if you feel a lot of comfortable, if nothing is, if you don't get any discomfort when you are sleeping on the left side, kindly sleep on the left side most of the time. But at least for a short interval, you can change the left side. It is not bad, you can change. Now, let us talk about some of the sleeping position that you should avoid when you're pregnant. So, in addition, for to discourage a right side sleeping for a long period of time, healthcare provider typically caution against back sleeping during second and third trimester. We said first trimester you can sleep on your stomach, on your back, but on the second and the third trimester, avoid sleeping on the back because it will cause back pain. So, as the pregnancy progresses, back sleeping causes weight on the uterus. You are suppressing the uterus, and you are putting pressure on the uterus, and you are suppressing the artery called aorta, and it is important vein, aorta and the vena cava, and those veins are important to supply the body with the blood. So this compression can make it harder for the heart to pump blood to the pregnant person and to the pregnant uterus and the fetus. So back sleeping can put pressure on the spine also. That is why you will get back pain. So this position may lead to an exaggerated lower back pain. So we are saying avoid sleeping on the back when you are pregnant. Yes. The last thing that I want to talk about is how you can get that good sleep. So we know that if you're pregnant, your time or the time you go to the toilet is increased. Now, you're supposed to avoid taking fluid during the evening or in the evening so that you get enough sleep at night. Also, you are supposed to avoid eating food that can increase heartburn because it will disturb the sleep. Another thing, you're supposed to do exercise so that the body can get exhausted, so that you get enough sleep. You're supposed also to eat uh, food that doesn't have caffeine, because you know caffeine suppresses the sleep. So you should eat food that doesn't have caffeine so that you get enough sleep at night. And to conclude, we were talking about best position for a pregnant woman. Just know that in the first trimester, you can sleep using your stomach. You can sleep on your stomach. But when you are in the second and third trimester, avoid sleeping on your stomach. Also, back sleeping or sleeping with your back, it's safe in the first trimester, but when you approach the second and third trimester, that first position should be avoided. The only position that are recommended is or are the left and the right lateral position, where you sleep on your left side or on the right side, elevating your knee a bit and supporting the head and putting the pillow in between your feet. And they are saying that sleeping on the right side, you can do it for a short period of time, but most of the time you should sleep on the left side. So I think I'm going to stop from there. In case you have a question, you should ask it on the comment section. I will consider answering that. So let's meet in the next video. Tell me what you want me to talk about in the next video. Bye till next time.